Have a good day.
You can do it!
Yeah, let's do this.
Open like you're in the dentist. That's not how you sit in the dentist.
We are one of the first healthcare teams that mobilized efforts to start testing and provide community testing for vulnerable populations in King County.
Well, happy Friday!
It's important to go to areas where we find that there are high positivity rates so that we can identify individuals who are infected with the virus and isolate them quickly.
UW-Medicine's mobile testing program has 2 vans. One fills the need for testing the homeless.
We know that patients who are homeless are at higher risk for acquiring COVID infection because they live in crowded conditions, they don't have access to hygiene facilities.
The second van increases access to testing, traveling to various locations around South Seattle and South King County.
What we found for communities of color and also limited English proficient communities that early on in the pandemic tended to affect disproportionately those populations.
Vamos a registrarte para que realices la prueba de COVID.
Since the program started in the spring, they've served more than 15,000 patients. They make it as easy as possible to get tested. You don't have to have insurance or be a UW-Medicine patient. There's also language interpretation for anyone who needs it, including the deaf and blind.
And so by having our mobile van in areas where they live, they feel much more comfortable going to those sites to get tested. It's much more easily accessible for them.
Making it a little easier during a time when there's so much that's unknown.
My work wants me to be cautious, and I myself want to be cautious. I called in saying, I don't want people to freak out because I'm coughing.
It's convenient, and UW has been super helpful as far as calling and getting a scheduled appointment as well at the Harborview location. I need to get this test so that I can go back to work or stay home if I'm positive.
And with the rapid results coming from the UW-Medicine Virology Lab,
oh my gosh, you guys are awesome, 6 to 12 hours.
The clinical staff and team can provide peace of mind, especially for Gilbert Walters. His daughter is pregnant.
I have COPD, so I have symptoms even though I don't have symptoms. I've been tested twice already, and I'm just being on the safe side.
Now that the model is set up, others are joining in the community effort. The city of Seattle took over the site at Rainier Beach.
That allows our vans to identify other areas where there are testing deserts and go to those areas to provide testing for vulnerable populations.
One of the sites is in Auburn. The mayor wrote a letter to Harborview. Part of it reads, "In times when cutback and increased efficiency are part of our daily lives, we would like to commend you and thank you for continuing this remarkable and generous service to your outlying communities."
It's really an example of what it takes to really promote health equity.